Hey everyone, and welcome to our deep dive into pain management. It's something you'll encounter every single day in your practice. It's fundamental to nursing care. We're going to explore the science of pain, the different types of pain, how culture can really influence a patient's pain experience.
Yeah, it's fascinating because pain is so much more than just a simple sensation. It's a really complex process involving our nerves and our spinal cord and our brain all working together.
Okay, so let's break that down a little bit. What is actually happening in the body when someone experiences pain?
Well, it all starts with those specialized sensory receptors called nociceptors. You can think of them like tiny little alarm systems located throughout your body. When they detect a potentially harmful stimulus, like a burn or a cut or even extreme cold, they send an electrical signal through your nerves.
So it's like a message saying, hey, something's wrong here.
Exactly. That signal travels through the nerves to the spinal cord, which acts as a sort of relay station. And here's where it gets really interesting. Before that signal even reaches the brain, the spinal cord can trigger a reflex response. It's a protective mechanism. It's designed to get you out of harm's way as quickly as possible.
So like when you touch a hot stove and you instantly pull your hand back.
Precisely. That's your reflex arc in action. It happens so fast, even before you consciously register the pain.
Wow, that's incredible. Our bodies are so efficient. But eventually that pain signal does make it to the brain, right?
Right. The signal travels up the spinal cord and into various areas of the brain. That's where it's processed and interpreted. And that's when you become consciously aware of the pain, its location, and its intensity.
I see. I'm starting to see how complex this process is. It's not just like a direct line from the injury to feeling pain.
Not at all. To add another layer of complexity, the brain can actually modulate the pain experience through the release of certain chemicals. These are called neuromodulators, and some of them, like endorphins and enkephalins, they act as natural painkillers.
Oh, wow. So some people might have a higher tolerance for pain because they produce more of these natural painkillers.
That's part of it, yeah. Another factor is something called the gate control theory. This theory suggests that we can actually influence pain perception by stimulating other non-painful sensations.
So like rubbing a sore muscle can actually help reduce the pain.
Exactly. The idea is that by stimulating those touch receptors, we can kind of close the gate on some of those pain signals that are traveling to the brain. This is the principle behind a lot of non-pharmacological pain management techniques, like massage, heat or cold therapy, and even 10NS units.
That's really interesting. It's making me rethink how we approach pain management. It's not just about masking the pain. It's about understanding the underlying mechanisms.
Absolutely. When we understand how pain works, we can start to develop more effective and targeted treatment strategies.
Now, speaking of different approaches, our sources talk about acute pain versus chronic pain.
Mm-hmm.
Can you explain the difference between the two?
Sure. Acute pain is what we typically experience after an injury or surgery. It's a sharp, intense pain, and it serves as a warning signal. It tells us that something is wrong and needs attention. The good news is that acute pain usually subsides as the tissues heal.
Okay, so it's a normal part of the healing process.
Exactly. Chronic pain, on the other hand, is a bit more complex. It's pain that persists for an extended period, often beyond the expected healing time. Think of conditions like arthritis, back pain, or nerve damage.
So it's not just about the initial injury. It's about the pain continuing even after the body should have healed.
Right. Chronic pain can have a really significant impact on a person's quality of life. It affects their physical function, their mood, their sleep, and even their relationships.
That's awful. It sounds like managing chronic pain requires a very different approach than treating acute pain.
It does. And understanding the type of pain a patient is experiencing is crucial for developing an effective pain management plan. We also have to consider things like the location of the pain, the underlying cause, and even the individual's perception of pain.
Right. And, our sources really emphasize how important it is to be mindful of cultural differences when it comes to pain.
That's a crucial point. Pain is not just a physiological experience. It's also influenced by a person's culture and their beliefs and their past experiences. What one person might consider excruciating, another might just describe as merely uncomfortable.
Oh, wow. So we can't just assume that everyone experiences and expresses pain in the same way.
Exactly. Some cultures encourage really open expression of pain, while others value stoicism. Some people might be more vocal about their pain, while others might downplay it, or try to just tough it out.
I can see how these cultural differences could lead to misinterpretations and even inadequate pain management.
Absolutely. As nurses, we need to be culturally sensitive and avoid making assumptions about a person's pain based on their background or their behavior.
So active listening, open communication, and a willingness to learn about different cultural perspectives are key.
They're absolutely essential. We need to ask open-ended questions, carefully observe those nonverbal cues, and just be respectful of each patient's unique pain experience.
It's so insightful. It's really highlighting how much more there is to pain management than just giving out medication.
It's about understanding the whole person, their individual needs, and their cultural context. And that's just the beginning. We'll delve into the world of pain assessment and explore the fascinating array of tools and techniques that nurses use to help their patients find relief.
This is getting really interesting. Let's take a quick break, and then we'll dive into the next part of our deep dive.
Welcome back. So now that we have a better understanding of the complexities of pain, let's shift our focus to pain assessment. This is where your detective skills really come into play as nurses.
So we're putting on our Sherlock Holmes hats and getting ready to gather clues.
Exactly. Accurately assessing a patient's pain is absolutely crucial for developing an effective pain management plan. And remember, pain is subjective. There's no one-size-fits-all approach.
That makes sense. What works for one person might not work for another. But how do we go about assessing pain if it's so subjective?
Well, the first and most important step is to listen to the patient. They are the experts on their own pain. Ask open-ended questions like, tell me about your pain. Where is it located? What does it feel like? How long have you been experiencing it?
So really encourage them to describe their pain in their own words.
Right. And pay close attention to their nonverbal cues as well. Things like facial expressions and body language and changes in vital signs. These can provide really valuable insights, especially for patients who might have difficulty verbalizing their pain.
What about those specialized pain scales we hear so much about? Where do those fit in?
Pain scales can be helpful tools, but it's important to remember that they're just one piece of the puzzle. They provide a way to quantify pain intensity, which can be useful for tracking changes over time and evaluating the effectiveness of treatment.
Are there specific pain scales that are particularly useful for nurses to know about?
There are several, and the choice of scale really depends on the patient's age and their cognitive abilities. For young children, the Wong-Baker FACES scale is a great option. It uses simple illustrations of faces ranging from a happy face to a crying face. It allows children to point to the image that best represents their pain level.
I remember that one from when I was a kid. It's so much easier to relate to those faces than trying to explain how much something hurts.
Exactly. And for adults with dementia, the pain aid scale is often used. It focuses on observable behaviors like breathing patterns and vocalizations and consolability to assess pain.
So we're adapting our assessment tools to meet the individual needs of each patient.
That's the key. And don't forget that assessing pain is an ongoing process. Pain levels can fluctuate, and what worked yesterday might not work today. So it's important to regularly reassess your patients, adjust their pain management plan as needed, and advocate for their comfort.
It sounds like pain assessment requires a lot of critical thinking and observation skills and empathy.
It does, but it's also one of the most rewarding aspects of nursing. When you can help a patient find relief from their pain, it makes all the difference in the world.
Well said. Now, I know we're all eager to delve into the world of pain management strategies. Our sources mention a multimodal approach. What does that mean?
A multimodal approach simply means using a combination of different strategies to target pain from multiple angles. It's about recognizing that pain is complex, and it often requires more than just medication.
So it's like having a toolkit with a variety of options to choose from.
Exactly. And we want to tailor our approach to each individual patient, considering their specific type of pain, their medical history, their preferences, and any potential risks and benefits.
Okay, let's start with non-pharmacological interventions. What are some examples of those?
There are so many great options. Remember the gate control theory we talked about earlier? Well, a lot of non-pharmacological techniques work by stimulating those non-painful nerve fibers and essentially closing the gate on pain signals.
So we're essentially trying to distract the nervous system from the pain.
In a way, yes. Techniques like massage, heat, or cold therapy, and transcutaneous electrical nerve stimulation, or TENS, all work on this principle.
I've heard of TENS units. Those are the little devices that send electrical impulses to the skin, right?
That's right. And they can be very effective for managing certain types of pain, especially musculoskeletal pain.
What about those cognitive behavioral therapies our sources mentioned? Those sound intriguing.
Cognitive behavioral therapies, or CBT, focus on changing the way people think about and respond to pain. They involve techniques like relaxation and mindfulness and distraction and even guided imagery.
So it's about empowering patients to take an active role in managing their pain.
Absolutely. CBT can be incredibly helpful for people who are struggling with chronic pain. It helps them develop coping mechanisms, reduce anxiety and fear, and improve their overall quality of life.
This is making me realize how much potential there is for non-drug approaches to pain management.
There really is. And let's not forget the power of things like music therapy and laughter.
Music and laughter. I can see how music might be soothing. But how does laughter help with pain?
Well, laughter releases endorphins, those natural painkillers we talked about earlier. It also helps reduce stress and tension, which can contribute to pain.
So a good chuckle can actually be therapeutic.
It certainly can. Now, of course, there are times when medication is necessary to manage pain, and that's where our understanding of pharmacology comes in.
I'm ready to dive into the world of pain medications. Can you give us an overview of the different types of drugs that are used for pain management?
Of course. We typically categorize pain medications into three main groups: non-opioids, opioids, and adjuvant analgesics.
Let's start with the non-opioids. Those are the over-the-counter painkillers that most people are familiar with, right?
Yes. Non-opioids include drugs like ibuprofen and naproxen and acetaminophen. They work primarily by reducing inflammation and blocking pain signals. They're often the first line of treatment for mild to moderate pain.
And they're generally safe when used as directed.
Right. But it's important to remember that all medications have potential side effects. For example, NSAIDs like ibuprofen and naproxen can increase the risk of gastrointestinal bleeding, especially with long-term use.
So it's about weighing the risks and benefits for each patient.
Exactly. Now, for moderate to severe pain, opioids might be necessary. These drugs work by binding to opioid receptors in the brain and spinal cord, altering the way pain signals are processed.
Opioids are powerful drugs, and they've been in the news a lot lately because of the opioid crisis.
That's right. While opioids can be very effective for pain relief, they also carry a higher risk of side effects, including addiction and respiratory depression.
So using them safely and responsibly is paramount.
Absolutely. We need to carefully assess patients before prescribing opioids, monitor them closely for any signs of respiratory distress, and educate them about the risks and safe use of these medications.
It sounds like a huge responsibility. Are there any tools to help nurses monitor patients on opioids?
There are. One tool that's widely used is the Pacero Opioid-Induced Sedation Scale. It helps us assess a patient's level of sedation and identify early signs of respiratory depression.
That sounds like an essential tool for any nurse who's administering opioids.
It is. And in case of an overdose, we have naloxone, a medication that can rapidly reverse the effects of opioids. It's literally a lifesaver.
That's incredible. It's amazing to think that we have medications that can counteract the effects of an overdose.
It's a testament to how far we've come in pharmacology. But of course, prevention is always the best approach. That's why prescription monitoring programs are so important. They help healthcare providers track opioid prescriptions and identify patients who might be at risk of misuse.
So it's a team effort to ensure that opioids are used safely and appropriately.
Absolutely. And nurses play a crucial role in patient education, encouraging safe storage and disposal of medications, and recognizing the signs of opioid misuse.
This is a lot of information. But it's so important for nurses to be knowledgeable about opioid safety.
It is. Now let's talk briefly about adjuvant analgesics. These are medications that are typically used for other conditions, but they can also enhance pain relief when combined with other pain medications.
So they're like pain management sidekicks.
You could say that. Examples include antidepressants, anticonvulsants, and corticosteroids. They work by targeting different pain pathways, and they can be particularly helpful for managing neuropathic pain.
Okay, I'm starting to get a better grasp of the different types of pain medications. But what about those times when a patient is on a regular pain medication schedule, but they still have those sudden flares of pain?
That's called breakthrough pain, and it's a common problem, especially for patients with chronic pain. The good news is that we have strategies for managing breakthrough pain, including short-acting opioids that can provide rapid relief.
That's reassuring to know. So even when pain flares up unexpectedly, it's not a hopeless situation.
Not at all. With careful assessment and a multimodal approach, we can help patients manage breakthrough pain and maintain their overall pain control.
Now, I'm curious about how we deliver pain medication. Is it always pills?
Not at all. We have a variety of methods for delivering pain medication. One method you'll encounter frequently is patient-controlled analgesia, or PCA.
I've heard of PCA, but I'm a bit fuzzy on the details. Can you explain how it works?
Sure. PCA involves a pump that delivers pain medication, intravenously, subcutaneously, or even epidurally. The pump is programmed with specific parameters, like the dose of medication and the minimum time between doses. but the patient has a button they can press whenever they feel pain, delivering a preset dose of medication.
So it gives patients a sense of control over their pain relief.
Exactly. PCA can be incredibly beneficial, especially after surgery or for patients with chronic pain that fluctuates throughout the day. It allows for more consistent pain relief, and it can improve patient satisfaction.
But I'm guessing there are safety considerations with a system like this.
You're right. PCA isn't appropriate for every patient. We have to carefully select candidates who are alert and oriented and capable of understanding the system.
And there's the issue of PCA by proxy, where someone other than the patient presses the medication button. That sounds dangerous.
It is a serious safety concern. PCA by proxy can lead to accidental overdoses and complications. That's why clear communication, education, and safeguards are essential to prevent it.
So lots of vigilance and clear protocols are key.
Absolutely. Now let's move on to another pain management technique. Epidural analgesia. Have you heard of this one?
I've heard of epidurals being used for labor pain, but I wasn't aware they were used in other situations.
They are. Epidural analgesia is commonly used to manage pain after major surgery, especially thoracic, abdominal, and orthopedic procedures. It involves delivering pain medication directly into the epidural space, which surrounds the spinal cord.
So it blocks the pain signals before they even reach the brain.
Precisely. And because the medication is delivered directly to the spinal cord, lower doses are often effective, which can minimize side effects.
That's fascinating. Are there any risks associated with epidurals?
There are potential risks. As with any invasive procedure, these can include bleeding, infection, and nerve damage. That's why careful monitoring and meticulous care are essential for patients receiving epidural analgesia.
It sounds like nurses play a vital role in ensuring patient safety when it comes to epidurals.
Absolutely. We need to regularly assess vital signs, monitor for any signs of complications, and educate patients about what to watch for and report. It's a team effort involving anesthesiologists, nurses, and pharmacists to ensure safe and effective epidural pain management.
This deep dive into pain management has been incredibly insightful so far. We've covered so much ground. From the science of pain to the various assessment techniques and pain management strategies. Is there anything else you'd like to highlight before we wrap up?
There's one more technique I'd like to mention, and that's peripheral nerve blocks.
I'm all ears.
Peripheral nerve blocks are similar to epidurals, but they target specific nerves rather than the entire spinal cord. They involve injecting a local anesthetic around a nerve or group of nerves to temporarily block pain signals.
I've actually had a nerve block at the dentist before. It completely numbed the area where I was getting a filling.
That's a great example. Peripheral nerve blocks are used for a variety of procedures, from dental work to minor surgeries to managing chronic pain conditions.
It's incredible how specialized pain management has become.
It truly is. And as nurses, it's our responsibility to stay up to date on the latest techniques and best practices.
Well, I'm feeling inspired and a bit overwhelmed by all this information. What are some key takeaways you'd like to leave our listeners with as we move into the final part of our deep dive?
I'm happy to share some final thoughts that will hopefully resonate with you as you continue your nursing journey. Stay tuned.
Okay, so we're back. We've covered so much ground in this deep dive. I feel like I've learned a whole semester's worth of pain management in just a few minutes. But before we wrap up, I'm really eager to hear your final pearls of wisdom for our listeners who are about to embark on their nursing careers.
Well, one of the most important things to remember is that pain management is not just about eliminating pain. It's really about improving a patient's quality of life, helping people regain function, participate in activities they enjoy, and live their lives to the fullest.
So it's about seeing the whole person, not just the pain that they're experiencing.
Exactly. And that means considering their emotional and psychological well-being, as well as their physical discomfort. Don't underestimate the power of just simply listening to your patients, validating their experiences, and showing empathy.
But the human connection can be so powerful, especially when someone is suffering.
Absolutely. And as you gain experience, you'll start to learn to recognize those subtle cues that tell you a patient might be in pain, even if they don't verbalize it. Pay attention to changes in their behavior, their facial expressions, their body language. Trust your instincts.
Now, that makes me think about what we discussed earlier, about cultural differences and pain expression. It's so important to be mindful of those.
It is. Don't let your own biases or assumptions cloud your judgment. Be open to learning about different cultural perspectives on pain and use that knowledge to guide your assessments and interventions.
Okay, and when it comes to interventions, we've talked about this incredible array of options, both pharmacological and non-pharmacological. How do you decide which approach is best for a particular patient?
It's all about individualizing care. There's no one-size-fits-all solution. You'll need to consider the type of pain, the severity, the underlying cause, the patient's medical history, and of course, their preferences. Don't be afraid to collaborate with other members of the healthcare team, like physicians, pharmacists, and physical therapists.
So it's about using all the resources at your disposal and working together to develop the most effective plan.
Exactly. And remember, pain management is an ongoing process. It's not something that you do once and then forget about. You'll need to continually reassess your patients, adjust their treatment plans as needed, and advocate for their comfort.
That makes sense. Pain levels can fluctuate, and what worked yesterday might not work today.
Right. And don't be discouraged if you encounter challenges along the way. Pain management can be complex, and sometimes it takes time to find the right approach. But when you see a patient find relief from their pain and regain their quality of life, it's incredibly rewarding.
I'm already starting to feel that sense of purpose and passion for this field.
That's wonderful to hear. Embrace that passion. And never stop learning. Pain management is a constantly evolving field, and new research is emerging all the time. Stay curious, ask questions, and challenge yourself to become the best pain management nurse you can be.
I'm ready to take on that challenge. This deep dive has been so insightful and inspiring. I feel like I have a much deeper understanding of pain management now.
I'm so glad to hear that. Remember, you have the power to make a real difference in your patients' lives by approaching pain management with knowledge, compassion, and a holistic perspective. You can help them find relief, regain function, and live their lives to the fullest.
Thank you so much for sharing your expertise with us today. It's been an absolute pleasure.
The pleasure was all mine.
And to all our listeners out there, thank you for joining us on this deep dive into pain management. We'll catch you next time on The Deep Dive.